All right, good afternoon. Thank you so much for tuning in here at TRC for the Voices of Recovery. We're just about to get things started. I wanted to do a quick shout out to all of our sponsors. Thank you so much. Thank you so much to our board members for making this possible. As I said, we're about to get started. So if you want to, go ahead and go online. There should be information there for you to log in. If you want to go ahead and begin donating, that would be super awesome. Anyway, without further ado, here we go. We're about to get started.
I was the kind of drug addict and alcoholic that even the drug addicts and alcoholics didn't want to hang around. You know, I come from a divorced family. My parents got divorced when I was 5. Growing up in an environment where my father is an active alcoholic. Sophomore year of high school, I got a girlfriend, and we ended up having a baby about 3 months before I graduated high school. Ultimately, I made the worst decision of my life, and I signed the rights over for my son. It's probably my biggest regret in life, and it threw me into a deep depression. You know, I felt like I didn't have anything to live for after that, and so I gradually got worse and worse. I eventually got into doing drugs intravenously, and my whole life revolved around finding out how I can get my next fix. After my 5th DUI, I'd gotten into an accident and rear-ended a family that had a warrant out for my arrest for that DUI. 6 months later, I wake up to a gun in my face about midnight. The U.S. Marshals had come and picked me up. I got to the point to where, I didn't want to die, but I didn't want to live anymore. It was just like, I can't keep going on like this. If I keep doing this, I'm gonna die.
Welcome to the Recovery Center's 2021 Voices of Recovery celebration. We'll check back with Matt to hear how TRC changed his life later in the broadcast. Each year about this time, we gather to recognize leaders, alumni, and law enforcement for their contributions to the recovery community, and to ask for your help in funding these services. TRC opened its doors in 1981. We happily celebrate 40 years of service to the recovery community this year. TRC is a private, nonprofit, inpatient detoxification and outpatient therapy facility. Each year, TRC assesses approximately 3,500 potential clients with stories very similar to Matt's. We are only able to serve about 1,500 of those assessed each year. Space is so limited. There are only 2 detoxification facilities with state-funded beds in Oklahoma. TRC, of course, is one of those. All other detoxification facilities in the state require thousands of dollars or an insurance policy, leaving those without the means on a waiting list. TRC wants to help address this issue. We have begun a capital campaign fund to build an additional bed tower adjacent to the existing TRC. Our goal is to raise the funds within the next 3 to 5 years. The privately paid or funded beds help us to meet the cost gap between what the state fund covers and what the full cost of detoxification requires. You will hear more about this exciting project in the coming months. Now let's move on to the awards section. There are various agencies in the community who make the wheels turn in addiction and mental health treatment. Every day, law enforcement interacts with people suffering from substance use and mental health disorders. Many officers assist with getting help for them, but we rarely hear about it. This award is designed to recognize these deeds.
Captain Daryl Miller has been with the Midwest City Police Department for 18 years. Captain Miller displays compassion and has a servant's heart towards the community he serves. He embodies our mission statement and will always go that extra mile to provide help or assistance.
The mission statement of the Midwest City Police Department is to provide law enforcement services, education, and leadership through community-oriented policing. He leads a team of 8 highly dedicated officers who are sensitive and empathetic to those in need. His homeless resource team is the go-to when situations arise regarding the homeless. The team works with individuals by linking valuable social services in hopes of improving their living conditions, thereby improving public safety. Captain Miller embedded jail diversion coordination from Red Rock Behavioral Health Services to facilitate services for those needing and wanting help. He has been instrumental in developing the homeless resource team and the program's success. He works tirelessly to ensure the homeless resource team is properly equipped to bring the utmost professional and personalized police service. It's such an honor to be here with you today, to honor such a wonderful officer going above and beyond and serving our community, specifically the homeless, addiction, as well as mental illness. You're saving lives, and I really appreciate you. And on behalf of TRC, our award for law enforcement this year. Thank you so very much.
Thank you.
As you can see, there are many in the community working to better the lives of those suffering from substance abuse disorders and mental health issues. Terry White is one of those. Terry's career has been dedicated to those suffering from addiction and mental health issues in her role as the previous commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services for the last 14 years, and is now the CEO of the Oklahoma Mental Health Association. Terry has been honored with many awards over the years, with the most recent being the Medal of Freedom, only the 6th Oklahoman to have ever received this honor.
Science has shown us that both mental illness and substance use are diseases of the brain, yet we don't treat them the same as we treat other diseases. Why is that? Stigma, misunderstanding, and fear often accompany thoughts about these disorders. As a society, we seem to be puzzled about treating these illnesses, believing it's harder to treat these diseases than it is any other disease. But the reality is, it's not. These diseases are as treatable as diabetes, as cancer, as other diseases. We seem to think that recovery is less likely from these diseases, but it's not. Even today, with the advancements in sciences and knowing what we know, our attitude towards mental illness and addiction, behavioral health disorders, remains much as it did 30 years ago. It's time that we change that. To reduce stigma, there must be a lot of education and a lot of story sharing. We have to make substance use, and more importantly, recovery from addiction and substance use, the norm. We must make it a natural part of the way we talk about the brain. We have to talk about brain health. We have to talk about lung health. We have to talk about heart health. As we talk about all aspects of health, that's how we'll normalize these diseases of the brain. We need to do the anti-stigma work that's very much needed. So when you're talking about recovery services, people view it the way that you would talk about treatment for diabetes, for asthma, or any other physical health condition that does not have as much stigma attached to it as the disease of addiction. During this time of pandemic, how has COVID-19 affected mental illness and addiction rates in Oklahoma? Well, Healthy Minds Policy Initiative estimates that during the first 12 months of the pandemic, hundreds of Oklahomans may die from behavioral health issues. Healthy Minds estimates that 260 additional deaths from opioid overdose and suicides may occur. And that's just due to economic hardship. Suicidal ideation and suicide attempts will increase. More than 34,000 additional Oklahomans may experience suicidal thoughts, and more than 9,400 additional Oklahomans may attempt suicide. Childhood mental health needs will increase substantially. For example, as many as 30% of children involved in quarantine may experience post-traumatic stress disorder. It has completely disrupted their lives. What is needed in terms of policy change is to continue to combat substance use in this state. To do so, we are making progress. Consider our being the only state with real-time access to a prescription drug monitoring system. We were early piloting the use of naloxone for first responders and to provide statewide over-the-counter prescription access for naloxone for any Oklahoman that needed it. The unintentional overdose rate involving a prescription opioid decreased by 43% between 2000 and 2017 right here in Oklahoma. Also, the opioid prescribing rate in Oklahoma decreased by 29% between 2013 and 2017. And we were one of only 10 states to see a decrease in the rate of drug overdose death between 2016 and 2017. I want to emphasize that prevention efforts are working, but there's still work to be done. We must continue to support trauma-informed policies. According to the United Health Foundation's 2019 health rankings, Oklahoma ranks first in the prevalence of adverse childhood experiences, or ACEs. Nearly 30% of our children report having experienced an adverse childhood event. Adverse childhood experiences can lead or contribute to deficits in mental and physical health, and specifically to addiction. It's important that we support policies that improve youth mental health and brain health in Oklahoma. Nationally, 1 in 5 children experience a disorder annually. 50% of mental health symptoms start by the age of 14, and 3/4 of all mental health issues emerge by age 24. Increasing our workforce training strategies and our workforce development is a must. We have to have more licensed alcohol and drug addiction counselors, more licensed psychologists and social workers. We have to make sure that they're available across our state, and we have to make sure that they're available right here in Oklahoma City. 8 years ago, the Oklahoma legislature demonstrated some incredible vision when it transferred the oversight authority of Medicaid dollars that pay for mental health and substance abuse treatment out of the Medicaid agency into the Department of Mental Health and Substance Abuse Services. The results were not just healthier Oklahomans, although that happened, but $1 million of savings because we actually matched people with the services they need. This year is going to be a really challenging year. And we have to advocate for the budget of the Department of Mental Health and Substance Abuse Services to meet the rising demands for more treatment for addiction so that they can continue to fund amazing entities like TRC. We must create a system that exercises a lot of grace and understanding when engaging with people who are dealing with substance use disorders. Knowing that recovery is a complicated process, it's incumbent upon us as individuals, as families, and as societies to make sure that it's as easy as possible, to be understanding that sometimes it's 1 step forward, 2 steps back, but recovery is achievable. It's incredibly touching to me to be here today and to be honored by the Recovery Center with the incredible Voices of Recovery Leadership Award. I'm grateful to be part of a life-saving work that the Recovery Center's staff and leadership do every day. All of you, TRC's many supporters, are making a difference. You're doing something that I feel Oklahoma is obligated to do, which is take care of men and women and their families whose lives have been affected by substance use disorders. When it comes to addiction, when it comes to substance abuse or mental health, it affects 1 out of every 4 of us. It looks like you, it looks like me, it's our friends, it's our family, it's our coworkers, it's members of our community of faith, and it's our children. So I want to thank you for helping them on their walk and their path to recovery.
Wow, Terry. Thank you so much for your presentation. That is so informative, and I can't believe any Oklahoman would not be passionate, or hopefully as passionate as you are, about giving and being a part of this experience. Recovery is so critical for all of us. And it is my honor to share with you this Voice of Hope Leadership Award, which we give out every year. There are so many amazing candidates that are available to try to share this with, and honestly, hands down, your efforts for the last 14 years that I've been around has just changed so many lives and has touched TRC directly. Thank you so much for all that you've done and all that you will do.
Thank you. I want you to know how much this award means to me. I know what an honor it is, and I will continue to do everything I can to live up to the standard that the Voices of Recovery Leadership Award creates by making sure that every Oklahoman knows and understands how important the work of the Recovery Center is to our state. Thank you.
TRC is fortunate to have a very active, service-oriented alumni association.
They work tirelessly to bring hope to those who come after them by bringing the alumni meetings weekly to the current patients. They also raise money to provide rides to residential facilities to graduating TRC patients. Each year, we recognize one of these hardworking alumni. To present the Voices of Hope Alumni Award is our current TRC alumni of 2020, Ricky Eichler.
My name is Ricky Eichler. I'm the TRC Alumni President. TRC Alumni's primary purpose is to be a Bridge the Gap group. When a lot of us have gotten to TRC, we have burned every bridge had and broken most, if not all, relationships. We are the first line of defense and some of the first sober people these clients will meet. The odds are stacked highly against us, and when I say us, I mean recovering addicts, alcoholics, and their families. 3 short years ago, I walked into TRC myself, and there would be a smiling band of misfits that showed up on Monday nights, laughing and greeting each other, ready to share their experience with us clients. And I wanted that. Matt, he gave me hope I could restore my relationship with my family just like he was doing. Matt and I would join the alumni committee together, get a joint bank account for alumni funds, and he would become someone I knew I could count on.
This whole journey started with me on my knees in my front yard, pleading with God to just help me to do something different. You know, I told him I'd go to TRC and go to treatment, and I did those things, and I had to get all that stuff out of my body so I could think clearly. Quickly made TRC alumni a commitment. I went there every week. It was something that was very close to me. The other times that I'd tried to get sober, I found my purpose in life was trying to carry the message to those still suffering. Just seems to get better and better every year. You know, things progress, my job gets better. You know, I start getting my license back. You know, I hadn't had my license in 10 years. So that's kind of was my first hurdle. Second hurdle, move out of sober living. I moved out of sober living, got my own place for the first time ever. It only took me 35 years.
Matt is the example of what a real friendship and a real recovering alcoholic looks like. I value his opinion and his experience. Congratulations, Matt. Matt, on behalf on behalf of TRC and the Alumni Association, congratulations.
Thank you.
You're welcome.
You know, my life's good. You know, today I'm able to be a son, a brother, you know, a companion, and all those things I never was. TRC is just, it's very integral in my story because that's where my journey started. I feel like I owe them my life.
All right, thank you so much, Matt. Wonderful, uplifting story, just like the other stories we've listened to this afternoon. Thank you so much for sticking around. You're a big part of this event, Voices of Recovery. I want to make sure that we give a big shout out to all of our sponsors. Thank you so much, and board members, thank you for making this possible. Most importantly, thank you for sticking around. I appreciate you, and I really need you to take this time to go ahead and go online and make those donations if you haven't already. We're still here, so make some comments. We will interact with you. Please continue to be that bright and shining star and being a part of helping others in recovery. Thank you so much, and have a wonderful afternoon.